Welcome everyone to today's webinar on new technologies and care models for primary care, based on Chilmak Research's latest report, Primary Care for the 21st Century. I'm Hannah Enley, Chilmak's Marketing Manager and today's webinar moderator. Before we begin, I should note that we are recording this webinar and will include it in our follow-up email if you have any questions during the presentation or discussion. Or if you have any questions during the presentation or discussion, please submit them via the questions tab on your GoToWebinar control panel that should have popped up alongside the presentation screen. We will address them at the end of the webinar as part of the discussion. Next, I'd like to introduce Chilmak Research. We are an analyst firm focused exclusively on healthcare IT and helping organizations adopt, deploy, and use technology to improve the care experience. We provide objective, comprehensive research for busy executives to create a more informed, future-ready market of products and buyers. Leading today's webinar and presenting highlights from this report is Chilmak Senior Analyst Alex Lennox-Miller, who is not pictured here, but whose name will show up every time we speak from this mic. Joining us as special guests are Dr. Danny Sands, co-founder and board chair for the Society for Participatory Medicine, and Justin Barnes, chairman for the Barnes Group. With that, Alex, would you like to tell us about your research?
Yeah, thank you, Hannah. I want to thank everybody listening. I want to particularly thank Dr. Sands and Justin Barnes for joining me today. I'm really looking forward to the conversation we're going to have. It's important whenever you're talking about primary care to recognize the value that primary care offers both to the healthcare system in general and to patients in particular. I don't think I need to go into much detail for the audience that we've got, but just generally, the longitudinal relationship that primary care providers build with their patients, the depth of understanding and insight that they're able to build into their patients' habits, into their circumstances and their health, and the ability to coordinate and guide care that their patients receive is really invaluable. Studies show that outcomes are better when patients have a good relationship with their primary care provider, when they're well cared for, when they communicate and trust that provider. And so any time that we're talking about primary care, we need to realize that we're not talking at any point about trying to replace that primary care provider. What we're trying to do is discuss the technology options and the offerings that can supplement or assist those providers. But at the same time, primary care is facing really significant challenges. Providers are retiring in larger and larger numbers, or they're leaving practice, and new graduates are not replacing them. Providers are being asked to do more for a larger number of patients, and those patients are frequently very complicated. They may have complex polychronic conditions. Providers are being asked to provide behavioral health services and other care that is really not what we consider to be their area of expertise, but they have to do it because the patients need it. The patients need to be cared for. The patients need to be communicated with. At the same time that we have fewer providers and more patients looking for appointments, it means that wait times for appointments are going up. Wait times have increased for various types of appointments between 50 and 170% over the last decade. And providers simply don't have enough time to provide adequate care. The standard amount of time most providers indicate as being required to provide adequate care to their patients over the course of a 2,000 patient panel requires more than 90 hours of clinical time per week. And that doesn't even include the additional time that providers are required to spend in documentation and other activities. So we can't get rid of the PCP. They're too important. So what technologies are we looking at here? Well, the report focuses on 3 real technology areas that enable primary care that offer some kind of relief or assistance to providers and patients, and that enable patients to be more involved in their care, to be more educated, more informed, to participate in shared decision-making, and really engage that relationship for improved results. The report looks at telehealth, at virtual and remote care platforms, and at AI symptom checkers and chatbots, and evaluates each of these solutions in 3 ways, in the ways that they influence access to care, the burden of care, and the cost of care, what you might call the ABCs. And the way that these technologies address the ABCs is different. Telehealth is really a way to assist in providing appointments and assist patients and providers to be able to interact. Virtual and remote care platforms offer ways, first of all, to sort of relieve some potentially unnecessary appointments. Chronic care requires check-ins, requires monitoring, and if that can be done electronically or online, some of those appointments and the burden of that communication can be taken off providers and staff. But they also monitor adherence, they monitor engagement with patient care plans, they allow patients to provide feedback and engage with their care team in a much more granular way about how they're feeling, about what the effects of different things are on them. Classic PRO proms activity. The AI tools similarly mainly aim to reduce unnecessary appointments within primary care by giving patients more information, letting them know ahead of time whether or not something in particular needs a trip to an emergency room or an urgent care clinic, or whether it's something that can be handled in a much more relaxed way. Those appointments are not just expensive to the health system, not just expensive to patients, they have a huge opportunity cost. So if people can avoid taking sick days from work, keeping children out of school, all of that doesn't just make people's lives a little bit easier, but it really significantly impacts their ability to care for themselves and care for their family. So the report really addresses those technologies and the effects that they have on the primary care system, on the people that are involved in it. The value that can be found when you utilize these technologies correctly to address those ABCs, the issues of access, burden, and cost, the ways that they can assist primary care providers and patients in getting care, in accessing care, in staying in communication, staying engaged with each other. And then some of the ancillary areas that affect these technologies and their adoption. So as the regulatory space changes, as the reimbursement environment changes with new CPT codes, with new billing options, as interpretations and the language used in some of those options improves to give a little bit more flexibility, all of those things help drive not just using this technology, but helping justify and give health systems reasons to look into it and take it on. These are the vendors profiled in the report. If any of them are listening or on the call, I want to thank you for the time you gave me as I was working on it. It's very much appreciated. And it really helped the report be as good as it and accurate as it could be. Each of these vendors is looked at. Many of them are either the leading vendors in their field or have something really particularly interesting about them. Most of them cross over the categories in some way. Very few of them are limited to the category that they're profiled in, but you know, you gotta break them up somehow. And all of them are looked at in how they influence those ABCs, the access of care, the burden of care, and the cost of care. So now we're going to move it over to the discussion and the Q&A. As Hannah said, if you have any particular questions, please enter them into the webinar platform so that she can let me know and we can ask our guests. As we're kicking off the conversation, I've got a few questions I wanted to ask. So, Dr. Sands, Justin, I'm really curious whether either of you have implemented or used any of these technologies, either in your practice or in deployment, and what your experience of that has been like on that end of the equation, whether you have anything that you would particularly tell people is valuable or useful about them, or any particular landmines or warning signs that have been a problem for you.
I could start with that. This is Danny Sands, and I'm a primary care physician at Beth Israel Deaconess Medical Center. I also work with a number of different companies, but I don't work with any of these companies, just to be clear. So in my practice as a primary care physician, we haven't used any of these technologies yet. I can tell you that, in a sense, we've been using telehealth for a very long time because we use a patient portal. And a patient portal is a way of providing telehealth. We often, in technology, we often think about telehealth as including video, but it turns out that patients mostly don't care about the video, and it's nice and it looks cool, but patients really just want to sort of chat with a doctor or a nurse most of the time. So I've been taking care of my patients using first email and then the portal since the early 90s, actually. And so in that sense, I do use telehealth a lot. It is asynchronous telehealth. We're in the process now in our practice, which is a large academic primary care practice. We're going to be putting in a telehealth pilot so that patients can have access to us without driving into the middle of Boston where traffic and parking are just horrendous. So we're going to be doing some work in that area, and our emergency departments have already implemented something like that.
Excellent. And I'll piggyback on Dr. Sands, my good friend I think I've known Dr. Sands almost for 20 years. I think when we started to explore some of these technologies together many moons ago. And I completely agree with him from the standpoint, certainly when it comes down to telehealth and the video aspect. I guess I'll approach it from two perspectives. Number one is I have a health plan in Georgia, and I'm not affiliated with any of the companies listed here as well. But I think your research is spot on from my perspective, at least. But I'll share comments again from two perspectives. One from a health plan perspective, where we've rolled out video, basically direct communication with physicians. It's a very unique model. It's not for everybody. It would be for people who it has a whole insurance package and promotion wrapped around a whole video telehealth platform where patients have access and members have direct access to a physician, not necessarily even a nurse, but they actually text their doctor securely, obviously, have video chat. But again, to what Dr. Sands said, most of them just use the secure messaging feature. They do not use the video chat. I think video is used probably 3 to 5% of the time. And that's only when the doctor says, actually, I would like to see you physically through the video. But 95, 97% of the interaction is through just secure messaging. So I completely agree there. It's a very neat feature to offer, and it's handy at times, but it's really not used as much as we thought it would be. But it's a great addition, certainly when you're in remote areas or, again, not wanting to commute in city traffic. So I totally agree with where the research is going from that perspective. Now, from the implementation phase, not outside of this health plan, but just working with primary care groups and hospitals and health systems out there across the country, it really is a digital front door. And that is the evolving strategy that I'm a part of today. And it's extremely exciting because we're really seeing how a visit is evolving. And it's actually it's evolving quite rapidly, to be honest. I mean, thousands and thousands of inquiries on, even in the past year of how to begin, where to begin. And again, I'll share that probably some best practices on a follow-on, but even I run a think tank, and part of that think tank, we spend a lot of time on virtual care, telehealth, and eking out best practices, and really how do we move our country forward? How do we move care providers forward? And how do we empower patients?
Yeah.
Because I think at the end of the day, having empowered patients, they tend to stick to care plans better, medication adherence when they're engaged, not told what to do or given a script, but when they're engaged through electronics and telecommunications or any type of mobile device or mobile app, they really stay engaged in their care plan and subsequently have better results and improved outcomes. So I'll price that.
And I'm going to build on that, Justin, because I think you're absolutely right. Just to underscore a couple of things you said. So one is this notion of a digital front door and increasing access to care, whether it's an organized healthcare system or just any care for patients who really don't have very good access. I think that's what a lot of these technologies are good for. I also want to build on what you said, that partnering with patients, empowering patients, engaging patients is really important. So now, wearing my hat both as a primary care doctor, but also as one of the founders of the Society for Participatory Medicine, that these technologies can be really empowering for patients. So arm them with information and give them, make it easier for them to access care and the type of care that they want. I mean, I think if you look at what patients need, they need three types of information. They need general information about health, about conditions, and then they need access to their own records, that type of information specific to them, access to my record, and then finally they need access to other patients who are like them. But then in the healthcare domain, they need to be able to, as part of this, sort of understand more about their condition, but also understand when it's time to seek help and avoid, having this triage ability so they can sort of self-triage. That's not quite so easy with many automated tools, but it's very good if you can access a practice virtually through a chat, for example, or through a portal, and connect with people and find out what do I need to do about this? Is this something I need to come in for? I think that becomes very important as well. And as Justin said, there's a growing body of evidence showing that patients who are more engaged and connected and empowered, what we would call an E-patient, where the E stands for engaged, empowered, enlightened, educated. These patients have better outcomes, lower cost, higher satisfaction. And so those, I think, are important goals for us as a healthcare system. And so we should be encouraging these sort of tools.
Yeah, no, I absolutely agree. We have a really good question from Kevin, getting into really the nuts and bolts of this. He asks, how effective are these technologies at integrating into the PCP and care team workflow?
That's actually a great question, Kevin, because this is really critical. And I talk about this a lot with physicians and especially a technology audience, because basically where physicians live, and they really do live, they live in this environment which we today call an EHR. And we're not going to have a conversation about the challenges with EHR usability and so on. And Justin and I had these discussions years ago. But what I will say is that anything that doesn't fully integrate with that EHR becomes much less likely to be used on the care delivery side, because, as I said, physicians spend all of their time in this system. This is their workflow tool, so it needs to plug in there. If you're going to force a physician, a busy primary care doctor, who literally doesn't have enough time to provide the good care that needs to be delivered, that's been shown in studies, then, if you got to get us to remember another login and log into another system to get information, that kind of becomes a non-starter for me as a physician. And I think that any company who's going into this space needs to understand the importance of that. Now, obviously, you don't necessarily need to do that if this is something that is just between this company or this service and the patient. But if it's something that's actually going to affect care delivery, really has to have some sort of connection. Justin?
Yeah, I'll certainly pile on there. Yeah, and actually top of my technology best practice checklist is integration, integration, integration. You've got to support the workflows. You cannot make the care providers do double entry or extra work or look in extra places, you really do need a single sign-on type technology. And the good thing is these EHRs are evolving fairly quickly. Certainly the leaders, they have APIs, and they tend to partner with some of the leaders out there. And so that's where I invest my time and where I help the most in the industry is where these integrations can occur, then I will deploy my resources. But if the integrations are not there, you're going to be littered with failure. You'll be failure with interoperability. You're going to have failure in the patient, failure in the provider, and certainly not going to receive the outcomes and the cost savings. So you really do need to look where integration can occur. So I completely agree. But when it does, it's a beautiful thing because it's fairly seamless for both parties, and everybody gets information. They have access, bilateral interoperability of data. The patient sees what they need to see. The care providers see what they need to see, and then you can have a lot of that machine learning. You can layer on the additional innovations that you spoke about briefly in the research, and then that's when we really start to hum. And that's when it gets even more exciting. So.
That's fascinating. Well, thank you guys for that insight. Got another question. Do providers trust the guidance provided by AI assistants, symptom checkers, and chatbots?
Okay, so this is a really interesting area. So first of all, the answer is probably no. I'm very serious about this. And then the reason is that I think many of us have had the experience where patients say, I have this whatever, and I won't name any names, but I went to a certain consumer website and I typed in my symptoms and it said I could have a lymphoma. And so I'm here to evaluate this.
Yeah, right.
And I'm saying, no, you have eczema or, whatever. It's like, what it can do is it can really panic patients. But what happens is that on the physician side is we've learned that most of this stuff is total bullshit. However, let me just qualify that. And I'll say that looking at my own experience, although I see a lot of that, there are times when patients are going to come in and say, I have this and this and this, and WebMD says I might have this. And I'll say, that's interesting. I wouldn't have necessarily thought of that, but maybe you do. And it turns out that they do have this thing. And so I think that the tools, I think the tools are perhaps starting to get better, but I still by and large that's not happening that much. Things will change, obviously, with time. And then on the physician side, there's a whole other piece of this, which is that increasingly in our EHRs, in our decision support systems, physicians are going to be shown the results of machine learning algorithms, and it's going to say, consider this and this and this. And the problem is that although a lot of physicians have learned to understand a multivariable analysis, and this kind of traditional analyses, when you talk about AI and machine learning algorithms, it is really a black box. Yeah. And so there's a huge gap in trust there. And frankly, there should be to some extent, because these things can't be explained and there may be built-in biases.
I will say, and again, this is something that gets addressed in the report, but as we see more and more AI technologies move beyond the black box model, as they start to be more open, and this is something being driven both from the provider side, as providers, show that they really need to see the origins of these conclusions, and from the regulatory side, as CMMI really pushes for open conclusion modeling. The more that you can see the sources, for example, if you've got a symptom checker and it says, well, we asked the following questions, here are the things that led to the diagnosis, here's what was present, here's what was absent, or the assessment, that's the stuff that anecdotally, I don't have the direct provider experience that Dr. Sands has, but from the people I've talked to, that's the stuff that builds trust and helps providers trust that some of what they're being told, might be more accurate or more trustable.
Yeah, and I'm going to build on.
Sorry, go on.
Go ahead, Dr. Sands.
No, I was just going to quickly say plus or minus, Alex, because just knowing what the inputs are and what the outputs are really doesn't tell you what's going on in that black box, and it's still a black box.
That's true.
Because you can't describe for me what's going on sort of by definition, because that's how these things work. They're very complicated and they can't be explained easily. Sorry, Justin, go ahead.
Yeah, so no, and I actually agree with most of the things here said. So start off with Dr. Internet. I completely agree with Dr. Sands. I consider that generation one, and it's so funny because I have family members who Google certain issues, and I'm like, please never go to Dr. Google. Please don't ever do that because you're going to come back with lymphoma, cancer, stage 4. It's horrible. So I completely agree. However, the only thing I am starting to see the change in, and you guys addressed it here, is generation 2 and 3. And that's actually something we've been tackling inside the Health Innovation Think Tank, and literally watching, and I've been having doctors speak on this, where they have been highly skeptical because of Dr. Google through the years, but now they really are starting to say, hey, you know what, I'm certainly open to it, and they understand the black box, but they also understand where they do, in the heart of hearts, and this is what we're kind of starting to see. I was actually shocked, had several doctors come up and present, that they are beginning to trust more intelligent AI in the generations 2 and 3 now that we're starting to see. And so I really do, there's certainly a skeptical eye. We are nowhere near there yet. But I would say within 3 to 5 years, you're gonna see a big shift to the use and the trust as people, as they start to get it right. And there's less Dr. Google, who's just way off 99% of the time, but yet we start to build trust. So, and Dr. Sands brought this up. It's all about trust, and I believe that we'll be demonstrably closer to trusting in 3 to 5 years from now.
I think that leads into what's going to be the last question as we're reaching the end of our time. What do you guys see as the timeline for adoption for some of these technologies? You know, we've been talking about telehealth for who knows how long, and some of the data shows that, you know, it really maybe has reached a tipping point. It's getting adopted more, it's getting used more. Some of these other technologies are relatively new. What do you see as the timeline for mainstream adoption for these kinds of technologies? And what do you see as helping that or hindering it?
Well, I would agree with Justin that I think we're going to start developing more trust in some of the AI algorithms at our own peril, by the way. But I think we will be trusting these things more over the next 3 to 5 years. And I think that there are going to have to be, and I won't go into that. In the interest of time, I won't go into that. But I will say that some of the other things are going to be driven by changes in reimbursement. So when you talk about remote care, when you talk about chatbots, the kind of things, I work, as you know, Alex, I work with a company called Conversa Health that does, you know, automated outreach to patients so we can monitor their chronic conditions over time. And that stuff is going to be driven a lot by reimbursement. And where reimbursement is going more towards population health, value-based care, that's going to drive the adoption. And I think that stuff is really ready to totally take off.
Yeah, I'll just pile on there and say it's really tied to you've only seen this spike, in my opinion, in use because you've seen the incentives follow and be created. So wherever the money goes, all this innovation really starts, the adoption goes, at least from and I don't want to be cynical, that's just what I've seen. I've been doing this for 20 years. And I mean, Dr. Sands and I literally are doing telehealth and remote patient, not monitoring, but communication 20 years ago, but it's not new. And none of this, it's just, finally we're having the reimbursement now and reimbursement infrastructures, and CMS, you know, largest payer in the world, is finally rolling it out at a grander scale. And so now you see adoption going up. So
great.
Well, with that, we have reached the end of our time. Thank you everyone for your questions, and I'm sorry we couldn't get to all of them. If you'd like to follow up with our presenters, please leave a comment in the follow-up survey right after we end, or email Alex directly. And thank you, Danny and Justin, for sharing your experiences integrating these tools into your primary care experiences or primary care practices and the lessons you've learned over those times. For more information on how technology and other consumer-centric healthcare trends are impacting primary care, I encourage you to check out our new report, Primary Care for the 21st Century, Technology-Enabled and On-Demand. I'll include the link along with this slide deck and a recording of this webinar in my follow-up email in a few days. Over the next few months, Chilmak will also release several reports evaluating other markets essential to providing care in a range of settings. Up first is the Payer Analytics Market Trends Report, available later this week. You can find more information about all upcoming reports in my follow-up email and on our website. With that, thank you everyone for joining us and have a great afternoon.